I am Hussain AK, consultant thoracic surgical oncologist at Apollo Cancer Center, Chennai. Lung cancer is one of the most commonest cancer in the world among the men and third most common cancer among the women in the world. But in India, among the men, head and neck and lung cancer is the commonest cancer, and among the women, it is the third most common cancer after breast and the head and neck region. Lung cancer generally presents with quite advanced presentation in India. Why? Because the patient comes late with diagnosis. The usual symptoms are cough, chest pain, hemoptysis, and shortness of breath. Early lung cancer is detected in India only in 10 to 15% of the patients. Remaining 84% are detected only in locally advanced cases. So, how to diagnose lung cancer? Lung cancer is diagnosed by imaging modality by a CT scan and by biopsy. Once we stage the patient with the lung cancer, then the treatment modality differs. We try to give all three modalities of treatment like surgery, chemotherapy, and radiotherapy. Surgery plays a predominant role in early lung cancer. Early lung cancer means the stage including stage 1 and stage 2. So how do we treat early lung cancer? We treat the patient by a minimally invasive thoracic surgery where we do a VATS lobectomy or a segmentectomy with the mediastinal lymph node dissection depending upon the stage of the disease. And after getting the treatment completely, patient usually recovers within a week because of our minimal invasive technology where the pain is less, the length of hospital stay less, the cost is also less, and the quality of life is far better than the conventional open surgeries. So after the surgery is over, the histopathology is reviewed, and based on that, the patient is recommended further chemotherapy or radiotherapy. What are the risk factors for this lung cancer? The risk factors for the lung cancer is the smoking is a predominant risk factor, and second thing is the air pollution, and third thing is the people who are working in industrial areas like pesticides, chemicals, radon, arsenic, asbestos, etc. So these people should be screened periodically to detect the lung cancers quite early so that we can treat them early and cure them. The quality of life after lung cancer depends upon the stage and diagnosis. The earlier the stage, the quality of life is far better for these patients. So the approach for these patients for quality of life is patients should have a behavioral biofeedback treatment and research involving the surveillance. If you want to have a good quality of life after lung cancer surgery, the patient should be diagnosed early. If you diagnosed early, then the quality of life becomes much easier for it. So how to diagnose early is only by doing a screening CT modality which can detect the lung cancer early and we can treat early. The basic issues in life after lung cancer is fatigue, weakness, which is more related to chemotherapy rather than surgery, and pain. But in our Apollo Cancer Center, patients do not have much pain. Why? Because we do by minimally invasive surgery. So the pain measurement is almost, we can say maybe 0 to 1. This is the quality of life after lung cancer.